This is a video about the elbow joint, how it bends, its articulations and supporting structures. We are going to cover it by going through the joints within the elbow joint. It sounds weird, but there are 3 bones to this joint that provide different movements. After this, we will briefly cover the common parts of this joint, like its capsules, different ligaments and the bursae. What's up everyone, my name is Taim, I'm a medical doctor and I make animated medical lectures to make different topics in medicine visually easier to understand. If you would like a PDF version or a quiz of this presentation, you can find it on my website along with organized video lectures to help with your studies. Alright, let's get started. Joints within the elbow joint. Feels so weird to say it, but let me show you specifically what I mean. We will first strip away all the connective tissue until we see the bones. What we can see now is the humerus of your upper arm and the radius and the ulna of the lower arm. Radius on the side of the thumb and the ulna on the side of the pinky. Now, usually a joint has 2 articulating surfaces. However, this joint is special because there are different articulating surfaces that make up 3 joints within. Let me show you how. Each of these bones are shaped in a way that allows the joint to move in a specific way. So first we have the trochlea of the humerus. This is the distal end of the humerus and is specifically shaped to match the trochlear notch of the ulna, which hugs around it to form a tight hinge. Then, just lateral to that, we got the capitulum of the humerus, a rounded structure that articulates with the head of the radius, or the articular area of the proximal part of the radius, if you want to sound correct. The head of the radius has 2 parts here, a shallow articulating facet at the top, and the articular circumference along its edge. Just beside that, on the ulna, we find the radial notch. These are the pieces we will need to define all 3 joints. First one is called the Humeroulnar joint. This is a classic hinge joint, like a door hinge, and it allows flexion and extension of the elbow. Pretty straightforward, but very stable thanks to the deep trochlear notch wrapping around the trochlea. That close fit is also why this joint doesn't allow any side-to-side movements. Next, we move to the joint between the articular circumference of the radius and the radial notch of the ulna. This is the proximal Radioulnar joint. It's a pivot joint, and this means that the head of the radius spins against the ulna. That is how pronation and supination happen. Watch as we rotate the radius over the ulna. This is pronation, basically palm facing down. When it rotates back, this is supination, palm facing up. Both of these are pure rotational movements happening at this joint. The third articulation is between the capitulum of the humerus and the articular facet of the radial head. This is the Humeroradial Joint. Technically, it is a ball and socket joint, but in practice, it mostly follows the movement of the Humeroulnar joint, so it flexes and extends along with it. It also helps transmit compressive forces from the hand and the radius into the humerus, like when you push yourself up from the ground. So those are the 3 joints that make up the elbow, and they're all packed into one functional unit by a synovial membrane that surrounds them. This synovial lining produces something called synovial fluid, which lubricates the articulating surfaces, reduces friction, and allows smooth movement. Just to clear any confusion you might have, even though we've been talking about 3 joints, there are no physical wall or septate dividing them. It is all one continuous synovial cavity, wrapped inside a single membrane. So if inflammation happens, like in arthritis, it affects the entire joint capsule, not just one of the components. Let's now look at the joint also from the posterior view to be able to understand it from all angles. Around the joint capsule, there are supporting structures called ligaments. These ligaments wrap around the capsule and help hold everything together. First, we can see the ulnar collateral ligament. This is a strong triangular ligament on the medial side, connecting the medial epicondyle of the humerus to the ulna. It is made up of 3 parts, the anterior, posterior and oblique bands, and it plays a huge role in resisting valgus stress. That is force pushing the forearm laterally, like what happens in overhead throwing. Then we've got the radial collateral ligament on the lateral side. This ligament extends from the lateral epicondyle of the humerus, but unlike the ulnar collateral, it doesn't attach directly to a bone on the forearm. Instead, it blends with the annular ligament, helping reinforce the lateral elbow without limiting rotation. This connection helps keep the radius stable during supination and pronation, working together with the annular ligament like one functional unit. The annular ligament in its own though is special. This ligament wraps around the head of the radius and anchors it to the ulna at the radial notch, keeping the radius in place while still allowing it to rotate during pronation and supination. Clinical note here, in kids under 2 years old, the annular ligament is not fully developed. So if you pull their arm too hard, like yanking them up by the arm, the radial head can slip out partially. This is called nursemaid's elbow or radial head subluxation. It is the most common upper limb injury in preschool-aged children. It usually presents with a sudden refusal to use the arm, but it reduces easily with a little supination and flexion. It's a very common reason for visits to the emergency room. Anyways, then we have the quadrate ligament. This is a short, thick structure between the neck of the radius and the radial notch of the ulna. It's small, but it helps limit excessive rotation and adds a bit of stability between those bones. Now, apart from the ligaments, the joint is also enclosed in a tough outer layer called the fibrous capsule or fibrous layer. It reinforces the joint externally and attaches to the humerus just below the epicondyles and to the ulna and the radius around their articular margins. At the front, you will also notice this little pouch-looking extension. This is the Sacciform recess. It's basically a fold in the synovial membrane that extends over the head of the radius to allow free rotation during pronation and supination without pinching the capsule. Now, in addition to all the ligaments, synovial membranes, and all the other structures supporting the elbow joint actually has another supporting system called Bursae. These are small friction-reducing pillows we refer to as Bursae. Think of these as synovial fluid-filled cushions that reduce friction between soft tissue and bone during movements. The most well-known here is the subcutaneous Olecranon Bursae, located right over the tip of the elbow, between the skin and the Olecranon. You can't see it normally, but when it gets inflamed, it's very obvious. This condition is called Olecranon bursitis, and you will usually see it as a swollen, red and tender elbow. Could be from repetitive pressure, like leaning on your elbow too much, or from trauma or infection. There are also other bursae around the elbow, like the subcutaneous bursae of the triceps brachii, which sits deeper near the insertion of the triceps, but the one you will see most clinically is the subcutaneous Olecranon bursae. So that was everything I had for the elbow joint. I really hope it all made sense. In the next video in the upper limb skeletal series, we will talk about the bones and joints of the forearm, the ulna and the radius, and how they are held together. Click the next video and I will see you there. If you want handmade PDF version of this lecture, take a quiz to test your knowledge, or access an organized list of all my videos, you will find everything on my website. Thanks for watching, see you in the next one.